There's a little-known truth that most seniors never hear at the doctor's surgery. Every year, millions of older adults undergo medical checkups, believing they're staying safe and proactive. But what if I told you that some of the most common tests, the very ones that are supposed to protect you, could actually do the opposite? Studies now show that nearly 1 in 3 routine tests given to seniors leads to unnecessary follow-ups, side effects, or even dangerous procedures. Even more surprisingly, almost every adult over 70 is being over-tested without realizing it. And here's the kicker. One test, the number one on our list, is now linked to thousands of cancer cases every single year, putting it on par with daily alcohol consumption as a cancer risk. This isn't something you'll see advertised on TV or hear in a waiting room, but the research is there, and today we're uncovering it. In this video, we'll break down 5 medical tests you should reconsider after turning 70. Why they may cause more harm than good, and what safer alternatives actually work. Stick with me, our number 2 is something almost every senior has faced, and the hidden risks may shock you. Before we get started, drop a comment below with your age, where you're watching from, and whether you've ever regretted a medical test or procedure. Do you think seniors are being tested too much? Don't forget to like this video and subscribe for more health insights just like this from Golden Echoes. Test number 5, bone density scan. On the surface, a bone density scan, also known as a DEXA scan, seems risk-free and straightforward. No needles, no pain, just a quick measurement to see if your bones are strong or at risk for osteoporosis. But here's what rarely gets mentioned. After the age of 70, these scans often create more fear than benefit. Almost everyone over 70 experiences some level of bone loss, but that doesn't necessarily mean it's a cause for concern. Let me say that again. That doesn't necessarily mean it's a cause for concern. Bone thinning is a normal part of aging, just like getting wrinkles or grey hair. The problem is what happens next. Many seniors are pushed into taking powerful osteoporosis medications, such as bisphosphonates. While they can help in younger patients with true osteoporosis, in older adults with mild bone thinning, they often do little except cause serious side effects like jawbone damage, digestive problems, and unusual fractures. One extensive study followed women over 70 who took these drugs. After 5 years, their risk of fracture dropped by less than 0.5%, a tiny benefit compared to the high rate of medication complications. Take Mary, a 75-year-old retired teacher. She had no history of falls, walked every day and felt fine. A DEXA scan labelled her with osteopenia, and she was prescribed medication right away. Within months, she developed acid reflux so severe that she had to stop playing piano, one of her favourite hobbies. When her doctor switched her focus to vitamin D, strength training and a calcium-rich diet, her symptoms disappeared and she stayed fracture-free. The bottom line, if you're over 70, haven't had fractures and remain active, a scan may do more harm than good. Instead, focus on balance exercises, strength training, and a balanced diet. These lifestyle steps can lower fracture risk by over 20% without any side effects. But if you think that's concerning, the next test on our list can be even worse, sometimes leading to brain surgery. Test number 4, brain MRI for memory problems. It's normal to get worried when memory starts slipping, forgetting names, misplacing keys, or repeating yourself. Many doctors respond by ordering a brain MRI to check things out. But here's the truth. In older adults, MRIs rarely provide valuable answers. Most scans show age-related changes like shrinkage or harmless white spots, which sounds scary but are actually normal. The danger is what happens after the scan. Once something unusual shows up, patients often get sent for more invasive tests, spinal taps, biopsies, or even surgery, all without any guarantee of improving memory. An extensive review of brain MRIs in seniors found that while over 80% of scans showed abnormalities, only 3% revealed something that could actually be treated. That means the vast majority of patients went through stress, fear, and sometimes dangerous follow-ups for nothing. Let me tell you about George, a 74-year-old who worried about his memory. His MRI showed white matter changes, which terrified him. He withdrew from social activities, convinced he had dementia. But when he was tested correctly with a simple memory screening tool, his results were normal for his age. With better sleep, hydration, and mental exercises, his confidence and his memory came back. Unless you're experiencing sudden and severe symptoms like seizures, major personality changes, or rapid decline, the cardiac stress test is one of the most frequently ordered tests for seniors. You either walk on a treadmill or take medication while doctors monitor your heart. The goal? To spot blocked arteries. The problem is accuracy. For people over 70, the false positive rate, meaning the test says there's a problem when there isn't, can be as high as 40%. That false alarm often leads to more invasive tests like catheterizations or stent placements. But here's the kicker. Research shows these procedures rarely improve survival or quality of life when done on people without severe heart symptoms. What they do increase is the risk of bleeding, kidney injury, and extended hospital stays. Raymond, a 76-year-old mail carrier, is a perfect example. He mentioned feeling tired on hills, so his doctor ordered a stress test. The results were unclear, so he was sent for a catheterization and had a stent placed. The next day, he suffered kidney complications from the dye used during the procedure. He spent nearly a week in the hospital, all for fatigue that was really just dehydration and aging muscles. If you're not experiencing clear symptoms like chest pain during exertion or severe shortness of breath, a stress test is rarely necessary. Safer options include a resting EKG or a coronary calcium scan, which can detect dangerous plaque without the same risks. Still, this next test might surprise you even more. It's one that many seniors have done multiple times, and after 70, it may actually be riskier than the disease it's supposed to prevent. Colonoscopy is considered the gold standard for preventing colon cancer. But after age 70, and especially after 75, the risks begin to outweigh the benefits, unless there are specific symptoms. The preparation alone is tough. Powerful laxatives that can lead to dehydration, dizziness, and even kidney problems. Then there's the sedation, which in older adults increases the risk of confusion, memory issues, or heart rhythm disturbances. And finally, the procedure itself carries risks of bleeding or bowel injury. A large study of patients found that for every 1,000 colonoscopies in adults over 75, only 2 lives were saved, but more than 20 people suffered serious complications. Dana, a 73-year-old bakery owner, is a cautionary tale. She had no symptoms and no family history, yet her new doctor urged her to repeat a colonoscopy. During the procedure, a small polyp was removed, but she developed a bowel perforation and spent 9 days in the hospital. She had already had clean colonoscopies in the past. But now we've arrived at number 1, the most overused and dangerous test of all. Full-body CT scans. Full-body CT scans are sometimes sold as executive health checkups, marketed as a way to catch cancer early. But the reality is alarming. Each scan exposes you to hundreds of times more radiation than a chest X-ray. There is no evidence that scanning the entire body without symptoms saves lives. What it does do is lead to unnecessary follow-ups, surgeries, and even cancer caused by the radiation itself. In fact, some estimates suggest that as many as 5% of cancers in the US may now be linked to medical imaging radiation, including CT scans. That means 1 out of every 20 cancers could be caused by a test that was supposed to prevent disease. Worse yet, full-body scans often find harmless abnormalities, like cysts or nodules. But once spotted, these trigger a chain of more tests and invasive biopsies. Marcus, an 80-year-old martial arts instructor, went for a private clinic's elite screening package. His scan found a tiny lung nodule. He ended up undergoing a biopsy which collapsed part of his lung and left him hospitalized for 2 months. The nodule turned out to be completely benign. That's why leading medical groups strongly advise against full-body CT scans for people without symptoms. If you have specific concerns, targeted scans can be helpful. However, scanning everything is akin to looking for treasure in a minefield. The risks can far outweigh the benefit. So, there you have it. 5 medical tests seniors over 70 should think twice about. Bone scans, brain MRIs, stress tests, colonoscopies, and finally, full-body CT scans. All of which sound helpful, but can backfire, leading to fear, unnecessary treatments, and even the development of new health problems. The takeaway? Always ask your doctor, what happens next if this test finds something? If the answer sounds uncertain or the risks outweigh the benefits, it may be time to skip it. And remember, the most powerful prevention doesn't come from a scan. It comes from lifestyle. Staying active, eating nourishing foods, getting deep sleep, and listening to your body. Now, I'd like to hear from you. Have you or someone you love ever gone through an unnecessary medical test or procedure? What was the outcome? Share your story in the comments. Your experience might help someone else avoid the same mistake. Thank you for watching. Before you go, please like and subscribe and hit the bell icon so you get notified when we publish our next video here on Golden Echoes. Take care of your health wisely.